was younger, I grew up with a lot of boys in the family, always running around. And my two younger cousins and my one older brother are the people that I really grew up with at my grandma's house. And there was always this book called Nurse Nancy that my family would relate to me. Nancy liked to play with dolls. She liked to play mother, she liked to play teacher, and best of all, she liked to play nurse. They would run around, they would get hurt, and I was always the one that would run with a Band-Aid or run to make sure that everyone's okay. And that's part of the reason that I knew that health science was one of those things I wanted to be involved in. My original plan was athletic training, and this school has one of the best athletic training programs as well. And then I realized through nursing that opens so many more doors because there's so many opportunities to be involved in sports medicine, in orthopedics, in so many different fields with a nursing degree. Choosing the nursing program allowed me to see lots of different perspectives of the healthcare industry and also how healthcare workers work in so many different teams. We are one of the programs that get to go to lots of different specialties and see lots of different floors and how they work with their nurses. And having that opportunity has definitely helped me and others realize what specialty they're interested in, what kind of nursing they're interested in, and what they would want to be pursuing longer term. I've been involved in lots of great opportunities at the College of Nursing, including the Emerging Nurse Scientist Fellowship Program that allows nursing students to work with nurse scientists to conduct research on different topics. Another great opportunity I had was going on a global trip for my public health clinical. I went to Chester, England, and we looked at creative health that they're using in their health systems.
Let it be, let it be, let it be, let it be.
So we got to do a lot of singing and dancing and looking at how these different things are impacting health and looking at the evidence-based practice as to why it is really good things to have in their healthcare system. To see different sides of healthcare and different sides of the nursing profession specifically, I've realized that not all nurses are bedside nurses and not all nurses are nurse practitioners, but a lot of nurses are advocates, a lot of nurses are working in health policy, and a lot of nurses are doing things involved in their community that really create an overall better system for patients and community members. Over the summer, I'm going to be conducting research on maternal and child health, and then after that, I'm going to be beginning my nurse residency program in DC. I hope to be involved in health policy further since I have experience with the Florida Center for Nursing. It's something that I've grown very passionate about and I look forward to being involved in it further. Nurse Nancy was so busy she could scarcely think. "Well," she said, when supper time came to end her busy day, "I'm certainly glad I'm a nurse." The College of Nursing provided me with so many opportunities to be involved in research, in leadership, and policy, and all of those things, aside from the normal didactic and clinical that everybody gets to experience, I've realized that I can use my voice in many different ways, and since nurses are the most trusted profession, I feel like we have a responsibility to make sure that we're advocating for all populations, including ourselves, and I'm really proud to be a USF nursing student and to have that experience on my back.